Good morning, everyone, and welcome to our Safe and Calm webinar for May 19th. We all know that a lot has happened during the past 2 weeks, and it also seems that there's a lot of confusion right now, not only for residential long-term care here in Michigan, but also for the general public. And I feel that part of the difficulty, at least for me, is the number of revisions to some of the original guidance. And some of the old guidance has clearly not been updated, but is still posted on a lot of the MDHHS sites. So we're going to spend some time this morning working from the current documents for the most relevant topics and do a brief review of the rules about that. So today's agenda, we'll start with our advocacy update with a focus on the budget. That, of course, will be presented by Dalton Herbal, our Director for Public Policy. And then we'll do a very brief situation update, and we will close with a review of a guidance for the major topics that affect our provider members the most. And then there are a few additional recent CDC updates. So at this point, we'll hand the presentation over to Dalton.
Good morning, everyone, and welcome to today's Safe and Calm call. I wanted to do a quick review of the budget today. We covered it about a month or so ago because we've reached a point in the process where we start to see some early indications of the final budget. So we're going to do a brief review of the timeline and the process for the budget today, then highlight on some key areas for long-term care. And then we'll discuss the Attorney General Sentinel project here, since we haven't done that on one of these calls yet. So the state budget, just some general points here. It runs from October 1st to September 30th of each year. So the legislature and the governor have until September 30th to come to an agreement. And to start off the process, the governor will submit a budget recommendation for the next year, which within 30 days of when the legislature first convenes. So once they come into town for the first time for that current legislative cycle, the governor will submit a recommended budget to start the process and start kind of the target points for everyone to talk about. The governor's budget recommendation needs to be balanced and uses the January CREC information for projecting revenue for the state. And CREC is Consensus Revenue Estimating Conference. Typically they have 2 of these a year. One's actually coming up in 2 days here. But this is when the state gets all their financial people together and projects what the revenue will be for the year for the state so they can make accurate budget decisions. I think I kind of touched on everything here. There's the January CREC and the May CREC. The May CREC is coming up in 2 days. So we'll actually have a pretty clear budget picture in 2 days. And the kind of, I guess I didn't highlight the point that we reached today, but we'll talk about it on the next slide. The House and the Senate have each responded to the governor's proposed budget with their own individual budgets and passed them out of their chambers. So we're at the point where the House and the Senate will start negotiating with one another to see what they like in each other's budgets. So if we go to the next slide, we'll see like a pretty clear timeline here based on the month. And I thought this was a really good illustration. I stole this from Chris Harkins, who presented at our Finance and Strategy Day. I thought he did a great job. And anytime we can get someone like that, I would recommend you attend the session. It's great information. So you can see in January, the governor delivers her State of the State address and prepares the budget recommendation for submission. February, she submits it typically, and that starts the legislative process for budgets. So then over the next 4 months, which is where we're currently at, subcommittees make their decisions. So these are your appropriations committees in the House and the Senate. They meet, and then each floor will take a vote, and then they'll concur with one another, which is where we're at right now in May. So we're still on time. Then we'll spend July through September with the governor seeing what budget she signs, what she doesn't like, and they'll negotiate there. And then October through November and December is when the new fiscal year begins. So if they don't have a budget by September 30th, we'll go into a state quote unquote shutdown, if you've heard that term. So some highlights, I know we discussed these on the call, but they are present in, well, some of these are present in both budgets and some aren't, but I'll highlight those. So as I said, the House and the Senate each passed their own version of the MDHHS budget. And this budget is important because that's the budget that has the long-term care item lines in it. So that's where we get our funding from the state. For the year, there's a Medicaid match rate increase of about 1.4%, and they assume the continuation of the enhanced FMAP rate. There's a dollar sign in front of that, but it should be 6.2% through December 2021. The Senate has passed their budget with funding for a $2.35 per hour increase for direct care workers to last throughout the next year. There's also 1,000 My Choice waiver slots, and there's a $37.5 million fund to support nursing homes throughout the state to make up for lost revenues at the state level. You might be familiar with some of that from the federal funds. An important point of difference here is the House doesn't include any funds for direct care worker wage increase. So this is likely to be one of those points of contention that they're negotiating right now. And I know they're looking at a number of other options to try to figure out what is the best way to take the state forward. So that's all I have on the budget today. I did want to touch briefly on the Attorney General's Sentinel Task Force on the next slide. So for those of you who have not heard about this project, we did release some stuff in a newsletter a couple editions ago in a member update, if you want to read it in more detail in writing. But what the project is essentially is the Attorney General's office response to issues of abuse and neglect that they've heard throughout the state. And they're following a model based out of California for this that has seen some kind of, I would say, results from their perspective. So what this project actually is an unannounced visit by a specially trained staff member to look for evidence of abuse and neglect. I should say actually team of staff to look for criminal evidence of abuse and neglect. So they're looking purely at criminal kind of legal proceedings and not the regs. All long-term care settings are going to be included in these. They already are. So if you have had one of these visits in the past, you may have thought of it as or you would have seen it as a single member of the Attorney General's office coming to your facility and looking for evidence. They have been doing these in the past, but now they've expanded that to include a specially trained team to look not only at that one isolated incidence of abuse and neglect, but to kind of really look at your whole facility. And as I said, they're including all long-term care settings. The staff themselves are part of the health fraud division within the Attorney General's office. This is where she's not only handling what we would think of as health fraud in terms of financial, but this is where she's kind of putting a lot of the Elder Abuse Task Force resources to look into these complaints. And as I said, these complaints are triggered by, or these investigations are triggered by complaints, and then they also mix in and look at a provider's past history of quality. And so they'll look at both those things and determine, do we need to go visit this person, etc. So far, I have only heard of 2 investigations that have happened within this project, and both of which the facilities and individuals were cleared of any wrongdoing. And I attached the announcement video. It's like 1 or 2 minutes, a YouTube video that the Attorney General made to announce the project. And once again, if you have any questions or you want a more in-depth reading of this, I can send something your way. Please just let me know.
All right, thank you very much, Dalton. We do have a couple questions, so I'll just hop right into those. Is that direct care worker increase supposed to say $2.35? We are currently doing $2.25, so is this an added increase?
You are correct. It's supposed to say $2.35. It would be a 10-cent increase for the next year. So this program's kind of been done piecemeal, and every time they have added more funds into the pot, they have increased it by some amount. So this next amount, if it's passed and if this is what's negotiated, because once again, the House doesn't have anything in their budget for it right now. The Senate wants to make it $2.35. And they've really been the people driving the issue. So it's likely to see that more likely to see a $2.35 increase, or 10-cent increase, $2.35 going on in the future.
Okay. Are the AG visits for the project to look at former allegations or look for new issues? You mentioned 2 facilities who were cleared of wrongdoing, so it sounds like those were visits for a concern.
Yeah, so they are looking at concerns. So some of these are obviously, most of these are triggered off complaints. So they're looking into the complaint specifically. And the difference is now that they're sending this team out there to look more holistically at the whole thing. So if they come in that day and they see another issue of criminal abuse and neglect going on, they will mark that down and see what they can do. So it's kind of both, but their focus is really on what triggered the complaint in the first place.
Okay. This increase will be effective in the next fiscal year, correct? It will not be effective until October 1.
You are correct. So the 225 right now goes through September 30th, which was very intentional by the legislature. So if you recall on that timeline, the new budget will take effect October 1, and that's their due date for the budget. And so going forward, the $2.35 will be effective October 1, if that's how this all shakes out. It's likely to, and everything we've heard is that the Senate still wants to do this, but that's essentially when it will be in effect. So to answer your question, it was kind of long. Yes, October 1 will be the start of the $2.35 if it gets passed that way.
All right. It looks like that was the last question, so we can go ahead and move on. Thank you, Dalton.
Okay, so we will now move on to the situation update, and we are very happy to report that the numbers continue to improve, both for the general population and residential care facilities here in Michigan. So here we're looking at our routine graphic of the 7-day average caseload, and you can see that it continues to take a sharp downturn, and that's very good news. The 7-day average number of deaths also decreasing, but as we know, it follows the caseload numbers generally, and it's decreasing at a much slower rate, but it is finally going down a bit. Last week, AARP started posting a monthly review of several key measures, comparing each state to all the other states. These first 2 graphics here show Michigan's cases and the deaths per 100 residents in nursing homes. So this is just about nursing home data here. Michigan lies in a medium range in terms of overall cases per 100 residents, but it also has a fairly low nursing home resident death rate. Remember too that AARP is posting this as a 4-week snapshot ending as of May 13th. And I believe they intend to continue to post these numbers on an ongoing basis. They're also measuring PPE. Specifically, they're measuring the percent of facilities reporting an urgent need for PPE. And we find that 7.1% of Michigan facilities were having difficulties obtaining supplies during this past month. Again, this puts Michigan in a medium category compared to others. The other graph, a little bit more concerning. Note that the staff cases per 100 residents, wow. For some reason, we are far higher than all the other states. And remember, this is for the 4-week period ending May 13th. The only thing I can think of is that it might be related to a low staff vaccination rate, but we don't have any data yet that compares our staff vaccination rate to other states. But we do know that NHSN is starting to measure that now, and so we'll be able to see if that's the defining factor here or not. This last AARP graphic identifies the percent of facilities reporting staff shortages. While Michigan is not listed at the very top of the list, we still have a fairly high percent of nursing homes reporting staffing issues. Actually, about 35.6%, over a third of our nursing homes are reporting problems with staffing. In our review of the Michigan County positivity rates, you can see that finally, for the past 2 weeks, the numbers have started to go down. It is still important to note, though, that almost half of the counties in Michigan were still at a red level as of this past Monday. When we look at the Michigan long-term care facility data as published by MDHHS, in general, it is all pretty promising. The new SNF caseload numbers went down a bit further. That's good. The HFA numbers decreased by quite a bit, so that the new cases in those provider groups were very, very small over the last week. And the same kind of decrease is true for AFCs. The number of new cases in that setting are also very small. So for residents, it looks like we're doing very good in our residential care facilities. So when we look at all the numbers, you can see that the number of new resident cases continues to decline. But as we discussed earlier, when looking at the AARP slide, our staff cases, while still coming down a bit from about a month ago, they're still pretty high considering the number of facilities we have here in Michigan. 201 over the past week, new cases. Recently, Michigan embarked on a reopening plan that I think they're calling Back to Normal or something like that. This graphic is from a media internet site called The Bridge. And they list the vaccination rate milestones that MDHHS has published that are needed to reopen some businesses. When this graphic was produced last Friday, we were at 55.6% vaccination rate. And that passes the marker where workers will be returning to offices. They will not be required to work at home if they can work at home. Currently, the numbers are going down a bit because they've added the younger teenagers to the eligible group for vaccinations. So I'll have to see how that plays out. But right now they are using the 16-year-old plus to identify these milestones. So based on the MDHHS website, office workers can return to work starting May 24th. And as of yesterday, the department reports the vaccination rate to have gone up to 56.5%, again, for persons 16 and older. So now we're going to move on to our review of the major relevant topics for residential care facilities during the pandemic. There are, of course, many other requirements and topics that affect us, but these seem to be the areas most concerning and at times most confusing. So we're going to do a quick review of the current guidance for each of these areas. So we're going to start with the masking and distancing CDC guidance. It has had a lot of impact across the United States. And this was the May 13th public health recommendation for fully vaccinated persons. They clearly state that fully vaccinated persons no longer need to wear a face mask or physically distance in any setting. However, note that this does not apply at all to healthcare facilities and all licensed residential settings in Michigan, even unlicensed assisted living, are considered healthcare facilities, or at least they're considered residential care facilities in Michigan. And all of those provider groups are subject, of course, to the Michigan regulations. So following the CDC update on May 15th, MDHHS issued its gatherings and face mask order, which has written, has always been a bit confusing to me because they use the word residential throughout the guidance, but it has different meanings in different contexts. At any rate, this guidance pretty much complies with the CDC. It's in alignment with that. Residential care facilities are excluded, and that includes nursing homes, homes for the aged, adult foster care, unlicensed assisted living, hospice, and substance abuse facilities. These are all venues that are not covered in this guidance, but independent living is included in this guidance. It is the only guidance we think that would be, it's the only form of guidance that affects independent living, except for one from MDHHS that we'll talk about later. So they talk about where you can resume activities without wearing masks. And the department also talks about how it impacts different kinds of persons. So fully vaccinated persons do not have to wear a mask in any setting, but it doesn't really identify anything about workers. It talks about gatherings, but it doesn't talk about workers. And MIOSHA has come out and said that businesses who align with the rule to allow vaccinated persons into their business without a mask, as long as they're vaccinated, would be appropriate. But MIOSHA also states that the emergency rules about workers are still in place. So there's an awful lot of confusion, and has been since the guidance came out, about how this impacts workers and what businesses should do. So everyone has been doing something a little bit different. MIOSHA states pretty much that they plan to update their guidance shortly, but they also note that the emergency rules about workplaces is still in place and in effect. Moving on to visitation. On April 27th, both the CDC and CMS updated their guidance for visitation. And between those two entities, the rules are pretty much in alignment. Remember that compassionate care visits are always allowed, and facilities can use the CMS definition for what a compassionate care visit is. Visitation rules apply to all residential settings except for independent living. Indoor visits are allowed for everyone except the following situations. Unvaccinated persons are not allowed visits if the county positivity rate is greater than 10% and the percent of residents vaccinated is less than 70%. So both of those elements must be true to prohibit visits to unvaccinated residents. Obviously, persons in isolation for COVID cannot receive visitors except for compassionate care visits. Vaccinated or unvaccinated persons in quarantine also cannot receive anything but compassionate care visits, but also remember that vaccinated new admissions no longer have to be quarantined. And we will summarize the Michigan guidance about that, which is in alignment with CMS right now. We're going to talk about that a little bit later. There are separate rules for facilities in outbreak status. We'll review that shortly as well. You still have to apply all of the core principles and safety precautions for visitation as identified in the CMS QSO. And there is one difference between the CDC guidance about contact and the CMS guidance. Only residents who are fully vaccinated can choose to have close contact, which is a little bit different than before. And the MDHHS guidance states that as well. So the department guidance here in Michigan about all this was issued finally on May 7th. At this point, I'm actually still not sure of where it was posted. I cannot find it on any of their websites, but it was sent out as an alert with a heading so that you can identify it easily that I kind of pasted on the slide. And the MDHHS document references also the order issued on March 17th with some reminders. And these reminders are not really anything new. And pretty much their findings aligns with the CMS updates that were revised on April 27th. So when we talk about outbreak status, the CDC and CMS guidance are also in alignment here. Facilities must continue to suspend all visitation immediately and begin outbreak testing as soon as a case has been identified. And that goes at least until one full round of testing has been completed. So after that full round of testing, if there have been no additional cases that occur outside the affected area during the first round, visitation can resume, but only in those non-affected areas. Facilities will have to be careful to review all of the contacts of the infected person to determine its affected area and its non-affected area. If that first round does include new cases outside the affected area, you must continue to suspend all visitation in the facility. Remembering, of course, that compassionate care visits are always allowed. And testing, whether you open up some areas or not, it's still required throughout all staff and residents until 14 days have passed since no new cases. And MDHHS aligns with these orders in their May 7th guidance. And also remember that that applies to all residential care facilities other than independent living. For testing, CMS updated QSO 2038NH on April 27th as well. They haven't changed a whole lot here. All symptomatic persons, whether vaccinated or unvaccinated, whether you're a resident or staff, you have to be tested if you develop any symptoms. Testing is still required, as we noted just previously during an outbreak, whether you're vaccinated or not. The routine for serial staff testing in nursing homes remains unchanged in general. And this is one area where the rules for nursing homes and other residential settings is different. And of course, independent living, again, not included in the testing strategies. Note that facilities must take the word of visitors as to whether or not they've been vaccinated. You cannot require them to show proof, and you also cannot require visitor testing anymore. The MDHHS guidelines apply to all residential settings again for HFAs, AFCs with 13 or more beds and nursing homes, except nursing homes must apply the CMS testing requirements, which are more detailed. Much of the scenarios which require the testing here have not changed, but for admissions, you must test all new unvaccinated persons unless there's been a test within the past 72 hours. And that's the same for staff. You must test anyone with symptoms, regardless of their vaccination status. You have to do weekly testing of all staff and residents during any outbreak. That 14-day rule still applies. And you have to do weekly testing of all unvaccinated staff. And an important change here is that the department no longer refers to the My Safe Start map at all. All unvaccinated staff must be tested weekly. And we also now know that facilities must obtain, maintain, and as we see later, report the vaccination status of all residents and staff. And the department is using the definition of staff very broadly. That's going to include all your contractors and your volunteers who are coming into your facilities as well. Asymptomatic persons are exempted from testing when in the 90-day recovery window. And of course, again, nursing homes have additional rules based on the QSO. And again, testing requirements in Michigan are still confined to nursing homes, all HFAs, and any AFC that has 13 or more licensed beds. And although we just reviewed the May 5th MDHHS testing update, they are telling us that their April 2 guidance still applies. And that guidance includes a grid about when to quarantine and when to test. So we're only going to talk about the testing part. We're going to talk about the quarantine information in a moment. But the only additional information here about testing is that it's not needed when returning, when residents are returning from family outings or medical appointments, as long as there's not been an exposure or the resident becomes symptomatic. Persons must still be tested when returning from a hospital stay, unless they've been tested within 72 hours or recovering, and that's true for any new admission. For quarantine, the CDC has their quarantine rules noted in the link guidance here. For MDHHS, we continue to reference that April 2 guidance that we were just discussing that also includes some information about testing. And this is the one guidance that includes independent living with all the other residential care facilities, and that is for the quarantine information only. We let MDHHS know how difficult and that this would be, but they have never responded to us so far, at least that I'm aware of about this, and that it's almost impossible for independent living providers to ethically and legally know the vaccination status of their residents. But again, MDHHS remains silent on that point. So for quarantine, you must continue to quarantine any resident with a significant exposure, whether or not they've been vaccinated, unless they're in recovery within that 90-day recovery period. MDHHS does allow for flexibility here if you're having a significant staffing shortage, but they also state that it is definitely not preferred. They want you to continue to quarantine any resident with a significant exposure. You are supposed to quarantine anyone symptomatic regardless of their vaccination status and regardless of whether or not they're recovering. No quarantine is required for medical or family leave that occur for less than 24 hours. For leaves greater than 24 hours, you only need to quarantine unvaccinated persons, or if there's been a risk for exposure. You do not need to quarantine an asymptomatic resident after a 24-hour or more leave, as long as they're in the recovery mode. And new admissions must be quarantined if they're not fully vaccinated. Transmission-based precautions. We've not really talked about these requirements for quite a while. They've not changed much recently. Generally, still CDC prefers the symptom-based strategy, and test strategies are only recommended for certain persons. And in Michigan, Michigan does not accept a test-based strategy. They've not talked about that in a long time. And basically, the only exceptions that the CDC or Michigan would support are those with significant immune issues. So if you remember many months ago, the length of isolation was changed from 14 days to 10 days based on symptoms. And if I recall, Michigan did not at first embrace that. But they do apply the 10-day rule now. So these rules are current for Michigan as well. Basically, 10 days after the start of symptoms or the positive test date is the length of that you have to apply transmission-based precautions, as long as the case is not severe or the person is not immunocompromised. For those severe cases, it could be between 10 to 20 days based on a consult, symptoms and a consult with an infection control expert. Test-based strategies are discussed in the CDC guidance, but again are not recognized by MDHHS. The CDC guidance does say that you can use a PCR test to exclude a COVID diagnosis for a suspected person. But if there is a high level of suspicion, even if the PCR test is negative, you should consider continuing precautions. Persons who are suspected but never tested should not discontinue precautions until meeting the criteria under the symptom-based strategy. And also remember that the testing algorithm for staff, including when you need a confirmatory test, that is included in both the CDC and the MDHHS algorithms, but I didn't include that today. For personal protective equipment, the CDC did include that as part of its April 27th guidance for vaccinated persons. But nothing has changed in terms of the rule. All the PPE requirements that you had before, they are all still in place for your staff. And MDHHS and the CDC still support using face shields. We have not heard otherwise about that. The only other CDC update on PPE that's been recent at all goes back to February. And it focused on the need to make sure that your masks are really well-fitting. So let's take a pause for questions. I know that I just spewed out a lot of stuff.
All right, thank you, Deanna. We do have a few questions, so I'll just hop right into those. Do visitors need to wear masks for an outdoor visit at a residential facility?
Yes, that has not changed. The requirements for masking for visitors is still the same. There has been no change there.
Do fully vaccinated dialysis residents still need to be tested regularly?
I do not believe that they do. However, I think that you are supposed to look at your individual risk that resident might have. So I think that that's an individual call on the part of the facility about, you know, how often they go out, how careful they're being, your local community transmission rates. Those are all things that you might look at, but I don't know of a requirement that says that you have to do that for persons in dialysis.
Okay. Any word on if volunteers are allowed?
That's a very good question. If I understand it correctly, I think you're asking what kind of volunteers are allowed in your facility. And the previous guidance from MDHHS often restricted those volunteers to persons who are assisting with visitation. I think that that's a question that maybe we should ask the state. I would think at this point, other volunteers should certainly be allowed. I mean, visitors are allowed in your facility. The volunteers that are allowed are subject to the same requirements for other staff. But I think that this is a good question. I don't think that they've ever been 100% clear on that. And that's something we could find out.
Okay. We understand that no mask for fully vaccinated doesn't apply to our SNF or HFA. What if a vaccinated HFA resident goes to the gym in our IL building? Can they unmask since they meet the requirement and they are outside of the HFA setting? Or do they have to mask, or do they have to wear the mask because they live in the HFA setting?
Well, that's a question that we've not gotten before, but my feeling is that once the person leaves your premises, I think that the public rules should apply to them. I do think that there is a statement to that effect in guidance that I read recently. So if they're fully vaccinated, they're going to an area where is more public and is guided by different rules. I think that they have to apply the rules of that setting. Now, this has not been asked, but and we can certainly maybe get more detail on that, but I don't see any rules that preclude that.
Okay. If our positivity rate is above or below 10%, then we test unvaccinated staff members only regardless of county positivity rate, correct?
Right now, you have to test everybody who's unvaccinated weekly. You have to test all staff who are unvaccinated weekly. They have removed, for Michigan rules has removed any reference to the local transmission rates. Then the only difference between that's the bottom line, is that nursing facilities would have to test twice weekly if the county positivity rate is greater than 10.
Okay. Did you say visitors need to wear a mask?
Yes, visitors still need to wear a mask when they are moving about the facility, and they need to wear a mask in general. Remember that there are rules that state that if a vaccinated visitor is visiting with a vaccinated resident in a single area, in other words, an area that doesn't include anybody else, they can take their masks off. And there are some contact rules as well, but again, there can be some contact, but only for vaccinated persons, and that, according to the new guidance, does require a mask.
Okay. Just to clarify, do all staff need to wear eye protection at all times along with mask?
Yes, at this point, MDHHS is still requiring that.
There are other facilities in our county that went to surgical masks with face shields instead of N95s when they have not had any cases. Is this allowed?
My understanding is that it is allowed. However, there is still this document out on the MDHHS website that pretty much says you have to wear full PPE still for everything. And that's one of the guidances that we have thought has been outdated for a long time. And we have brought that to the attention of the state, but they have not responded. But in practice, and based on CDC, et cetera, we believe that that's okay. Repeat that question for me, make sure I have the right part, Blake, please.
Okay. Give me 1 second. I just lost it here. There are other facilities in our county that went to surgical masks with face shields instead of N95s when they have had, or when they have not had any cases. Is this allowed?
Right. My understanding is that the guidance, at least for nursing homes, allows for N95s when you are working in a COVID unit, you're working in a quarantine unit, but not necessarily for general care. And that's what I think a lot of facilities have been going by. But again, there is that MDHHS guidance out there that requires for all daily care in all settings, full PPE. And again, I said this before, I know. We have asked them about the status of that, and they've not ever responded. It's still posted out there, but it's clearly outdated.
Do we need to test our vaccinated staff if we are completing outbreak testing?
Yes. In an outbreak, you have to test everyone vaccinated or unvaccinated, resident or staff.
Okay. Just to make sure, staff in independent living still have to wear a surgical mask even if they are vaccinated.
That is what we are hearing from MIOSHA right now, although they're not 100% direct about it. We do anticipate that they will change and update that guidance. But right now for workers, even in independent living, definitely long-term care, everyone has to wear a mask.
Do we need to communicate the vaccination data to residents and their representatives as we do for any positive COVID cases?
I have not seen anything written that says that you have to do that. No, the only reporting that I know of is to the state and to the feds.
You said MDHHS still requires eye protection, meaning face shield or goggles. Where is this written? The CDC guidance, which is what we were previously directed to, says it is required in areas with moderate to severe transmission levels. I know many have stopped the face shields when the rates improved.
Right, and I understand that probably is a practice. However, I believe it was a direct email response from MDHHS that said that face shields are still required. And remember that, 40 at least, 40 at least of our counties are still in the red category and a number are still in the yellow category. And I think that we can certainly ask MDHHS what their current thinking is, but as of a month ago, they were still requiring face shields.
Okay. Can we expect that the rules for LTC facilities will follow those of the public anytime soon? Groups of vaccinated people who no longer have to distance, etc.
I don't know about that really. I would not anticipate that in the very near future. I think that Michigan, as other states, is still going to be very protective of what goes on in long-term care facilities. Even though things are loosening up considerably, I don't think anyone, or at least any of the experts, think that the pandemic is over. So I wouldn't anticipate that in the near future. Maybe at some point during the summer, they might loosen up a bit more. But I do know that the experts are expecting another surge in the fall.
Do visitors need to wear N95s or just surgical masks?
They don't even have to wear a surgical mask. They can wear any kind of cloth covering. But they do have to wear a mask when they're moving about the facility, and unless they are, again, vaccinated and the residents vaccinated. But if they're in close contact, then masks have to be worn. Makes no sense to me, but it's true.
Is there a limit to how many visitors a resident can have at a time?
The MDHHS guidance still says 2. And there is a lot of facility discretion around scheduling appointments, et cetera, still. All of the same basic precautions and what CMS sometimes calls the core principles for visitation still apply.
So MDHHS is saying eye protection for every staff member on every unit, even if they are not in quarantine, dietary workers, non-direct care workers, etc.
My thinking about that and my understanding about that right now is we're talking about direct care workers. We're not talking about people who are not, in your resident halls. I think it's direct care workers. And that was my understanding based on conversations. In other words, it was not based on anything in a specific guidance. But I do know that a lot of people were asking perhaps maybe a month to 45 days ago and got a response from MDHHS that face shields are still required in direct care areas.
Okay. MIOSHA says the employer shall require face coverings to be worn when employees cannot consistently maintain 6 feet of separation from other individuals in the workplace. Rule 7-5.
I would have to look at that and make sure that that applies to long-term care settings as well. I've not read the MIOSHA rules myself since probably for a month or two, so that we can reconsider that. But a lot of controversy has arisen about what workers can and cannot do. So I would hope that MIOSHA is going to put out updated guidance shortly that's a little bit more clear.
Can you start talking with the state about recovered COVID-19 staff being treated similarly to vaccinated? I have not heard any discussion of recovered residents or staff and antibody protection.
Well, we can go back to some of those slides. I guess it depends on what you're talking about in terms of quarantine for exposures, testing, etc. If you're in a 90-day recovery period, you don't have to do those things. So there is a difference. You do have to be tested along with everyone else, especially if you have symptoms, as other people have symptoms, no matter if you're in your recovery period. But there are differences. Why don't we try and go back a little bit, Blake, to keep going. I'll tell you when to stop. Keep going. Hold on. Under HHS 5.5, asymptomatic persons recovering in a 90-day window are exempted when their diagnosis is officially documented for testing. So that is an exception. And that's not new, actually. Go back one more and let me see. There's another citation about, go back one more. Go back one more, it's not in there, I know. Go, you're going back too far. Okay, hold. Go back one. So I guess it's basically about quarantining for exposures and testing, but persons who are in a recovery window, but granted it's only 90 days, are exempted from those rules.
Sorry, I had to step away, and you may have answered this. Do visitors in independent living need to wear a mask?
Not if they're fully vaccinated, is my understanding from the public health guidance that came out. I'm sorry, the guidance for general public that came out.
Okay. MDHHS said to refer to the CMS QSO for visitation. That does not have the previous language of only 2 visitors. It says you can consider limiting to help maintain infection prevention measures.
Yes, but I think that if you go back to the April 2 guidance, and I'd have to check this to be sure, that there's a couple guidance that are still live out there. There's a March guidance, there's an April 2 guidance from MDHHS that speaks to the 2-person rule. Since you've submitted this question, I will look it up and check to make sure it's there. But I do believe I saw it a couple days ago.
By direct care staff, we are including all staff that come into close contact with residents, correct? Close contact being closer than 6 feet.
Correct.
Are vaccinated residents in a LTC facility able to congregate outdoors without distancing?
If they're vaccinated. Otherwise, all of the normal rules apply. And everyone in the group has to be vaccinated. So you can eliminate physical distancing, you can eliminate masking if everyone in the group is fully vaccinated. If not, then everybody has to social distance and everybody has to wear a mask.
All right, it looks like that was the last question, so we can go ahead and move on.
Okay. So the last topic on our review list, and I made this separately because the rules are kind of cut and dry here, is reporting. And this was issued from MDHHS yesterday for nursing homes. And I have to add a disclaimer here that we're not tracking all of the rules, requirements, nuances of reporting since we don't do it ourselves. It's almost impossible for us to understand it from in terms of experience. But anyway, this came out yesterday for nursing homes. They reported that EM Resource is now updated to align with CDC and HSN requirements for supplies. Beginning May 26, facilities are going to have to report POC tests, information to access the reporting tools listed here. Beginning June 13th, you must report any therapeutics, including vaccination information. And that data has to start to be collected on May 26th, but then again, the first reports are due on June 13th. MDHHS has updated this module that describes the reporting requirements for EM Resource, and the contact information for EM Resource issues is listed at the bottom of the slide. For HFAs and AFCs, Qualtrics is being updated for supply availability, and staff or resident vaccination status is supposed to be as reported as well. So the supply availability area will include a question about urgent need, and facilities are asked to mark yes if they will run out of their supplies in 7 days or less, with no other expectation of getting supplies. Facilities will have to report the number of residents and staff who've completed their vaccination series, as well as the numbers who have contraindications to the vaccine. And staff, that definition includes pretty much everyone except for visitors who come into your building. To be identified as a staff who needs to be reported, they have to have been in the building for at least 1 day during the collection week, regardless of their role and regardless of whether or not they have any resident contact. So this slide just simply includes the updated resource links for reporting guidance from MDHHS. The first 2 links are for nursing homes, and the last one obviously are for HFAs and AFCs. So we're going to end today with a few final CDC updates. The first is a CDC guidance for group homes for individuals specific to with developmental disabilities. It was updated on May 17. It includes the same kinds of precautions that are pertinent for other long-term care facilities. It does focus a bit on the particular issues that this population experiences. There's really not a whole lot new here, but it is a good review and it is updated. The CDC also posted an update for caregivers serving persons with dementia and living in the community. They put a lot of focus here on managing both the well-being of the consumer and the caregiver. Might be something you might want to look at. On May 11th, the CDC also updated its guidance for persons visiting or living in a retirement or independent living community. It does continue to include recommendations on protecting yourself, whether you be a resident or a visitor. In general, it doesn't speak to the vaccination status yet, so I don't know if we're looking for another update coming soon or not. And our last update is about the CDC considerations for owners of multifamily housing. This update continues to discuss all of the operational precautions and planning that you might need for another outbreak. It has been updated. I didn't see a whole lot new in it, but it might be something you want to review moving forward. Okay, I know it's been, there's a lot of areas still, let's just say that are a little gray. We will continue to try and work on those. Are there any final questions?
Yes, they are coming in, so I will hop into those again. Reporting of vaccine status include hospice staff.
Hospice staff in a nursing home or hospice staff in a hospice facility? If you're talking about a nursing home, definitely. They would be considered part of your staff or your contractors.
Okay. To clarify, all vaccinated residents may congregate without masking and without distancing during indoor and outdoor activities. If so, does this include communal dining and activities? Can they play cards with each other, sharing a deck, etc.?
Yes, as long as there's no one in the room who's not vaccinated. If there's anyone in the room, including staff that's vaccinated, then they have to social distance and they have to wear a mask.
Do AFCs smaller than 13 have to report on vaccinated staff residents, or is this only for over 13?
My understanding is it's only for over 13 beds.
Okay. Are LTC facilities allowed to ask staff for copies of their vaccination record?
Yes, you can do that for a visitor, but you can and must do it for staff. You have to confirm their vaccination status as well as those the status of residents.
Can we treat recovered residents like vaccinated residents related to activities and dining?
I don't think that that's the guidance specifically says that. But I imagine that you would. They don't have they have immunity, just like you would if you were vaccinated. But I don't know that the guidance specifically says that. So maybe that's something that we would look into, or you can make a determination on your own in the interim. But I don't see why there would be any risk to including persons who are asymptomatic and recovering from COVID in that group.
Okay. I glanced through a PowerPoint yesterday on the POC test reporting. Did I see that every test has to be individually reported on all staff, residents, and visitors?
I believe that that's true, but I can't speak to that 100%. Again, when it comes to reporting, it is very difficult for us to keep up with it since we don't do it and we don't understand the nuances. But I do remember that until at least recently, this was an individual reported kind of thing.
Okay. So right now that is actually looking like the last question. So as always, if you do think of anything after this webinar has concluded, you can email the Safe and Calm, Dalton, or Deanna at leadingagemi.org, and we'll make sure to get any questions answered for you. So with that, we would like to thank obviously both Dalton and Deanna, and we would like to thank the 90 members and participants that took time out of their busy schedules to join us for today's webinar. We appreciate everything you guys do each and every day to support your staff and provide quality care to your residents. We are grateful for your continued support, and we are here for you when you need our assistance and resources. With that, I believe that will bring us to the end of our webinar today. Our next one is scheduled for, it will be 2 Wednesdays from now. I believe that will be June 2nd. So right after Memorial Day, we will be back at it. So I hope everyone has a great remainder of their Wednesday, and we will see you guys on June 2nd. Thank you and have a great day.
Thanks, everyone.
Have a good day.